Hi, Dr. Brian Holtzabus, and I'm here today to ask a question. Why is this still a thing? Why is this still a thing? Why is this still occurring? So today I want to talk a little bit about why is this still a thing. Today I went on to Fox News, and Fox News said the #1 drug for lower back pain. And I thought to myself, well, this should be interesting as a chiropractor. Let's take a look and see what the #1 drug for lower back pain is. And it said, no, without a doubt, #1 drug for lower back pain is an NSAID, non-steroidal anti-inflammatory. And it's just hard for me to sit there and watch media talk to people about why NSAIDs are good for you and why if you have lower back pain, NSAIDs are a smart choice. When you look at I'm going to pull up my research paper right here, okay? This is scientific research. This is from the Journal of Science Transitional Medicine, titled Acute Inflammatory Response via Neutrophil Activation Protection Against Development of Chronic Pain, May 11th, 2022, Volume 14. So fact checkers on social media, there's the research paper, check it out. And it's basically this paper talks about the idea of using non-steroidal anti-inflammatories are actually a great way to get set up for chronic lower back pain. They're saying that if you use these things, they help out at the moment. So for the moment, you will feel better. You will get temporary relief. However, the continued use of these over and over again, you actually degenerate your body to the point where your lower back pain that's bothering you today becomes a chronic, meaning lasting for a long, long time, problem. This study was done with people with lower back pain and TMJ issues, and it showed that they all developed long-term chronic back pain because of the use of the non-steroidal anti-inflammatories. And so when they talk about using these drugs, like I saw in the media this weekend, how these help a lot with the acute lower back pain at the moment, and while that is true, it will help take away the symptoms of the lower back pain that you're dealing with at the moment. The research, which they should also follow up on the other research, shows that the continual use of these, but now the research shows it, creates chronic issues. And so yeah, you might get rid of your back pain today. You might be like, boy, it feels better. It's not actually better, you're not feeling it as much. But you're setting yourself up for chronic issues. This is going to hurt a long time. And so the people who said, I take one of those every day and my back pain stays away, no, you're having to take one every day because you keep taking one every day and you're creating a chronic problem. And it bothers me because there's so many other choices that are better, that we know are better, that are more effective. I mean, first of all, let's just start off with the obvious one. Icing your back. If you want temporary relief from a lower back swelling or inflammation, throw some ice on it. And that doesn't create degeneration or chronic issues. It makes you cold, but it's not going to create a chronic issue. And then the thing too, when you look at the North American Spine Group, okay, they actually did a study to see like what would be the contemporary concepts in spinal care, spinal manipulative therapy for acute lower back pain. So this is them doing a lit review on different areas of help lower back pain. Again, this one's PubMed index. You guys all know how I feel about PubMed. So this is Spine of 2010, October 10th, Volume 10 of Spine, which is a very good journal. And it basically says the Northern America Institutes, the North America Spinal Group says #1 thing to help out with lower back pain, it should be your first thing, is spinal manipulative therapy. That's their word in research about what we do. That's chiropractic. So the best thing you can do as far as not forming any habits, getting any kind of addiction problems, or setting yourself up for long-term issues, go with a chiropractor. That's what they found out with their studies and their research. Again, I'm just citing research there, fact checkers. Again, I quoted my references. I'll tell you again, this is NASS, Contemporary Concepts in Spinal Care, Spinal Manipulative Therapy. It's hard for me to say that word. Chiropractors we call it adjustment. But Spinal Manipulation Therapy for Acute Lower Back Pain. Simon, Dagenais is the main author. Again, Spine, Journal of Spine, 2010, October. So take a look at it if you don't believe me. Go read it yourself. This is the research, and this is the problem. We're not using research anymore. We're just going by gut feelings or what we think we know or what we have learned in the past. But when you look at the actual research, you look at the real science of things, it's pretty amazing that a lot of things that we do, I question why we still do it. Why is this still a thing? So this is going to be new little videos you'll see from me from time to time. Why is this still a thing? And I'm not going to say anything without producing the science to back it up. All right, thanks everybody.